Nothing happened.
Something happened.
It was a little kiddie ride.
She hates those rides. I don't understand why you insist on making her...
Okay, I appreciate the fullness of your answers, but I just wanted to know if she'd had any history of abdominal problems.
No.
The admitting doctor noted no family history of...
I have an aunt with Crohn's disease. You didn't mention that?
I forgot what it was called. Okay? Your aunt, she's got a million things wrong with her.
If you paid attention for 5 minutes...
I doubt it's Crohn's. She has none of the other symptoms.
You're alone with her for 8 hours. She ends up in the hospital.
I'm wondering if we can focus on answering the questions, Mrs. Hartman.
I'm not Mrs. Hartman. We're divorced.
I suspected.
Excuse me. You stash your drugs in a lupus textbook.
It's never lupus. Who's got gallstones and why do we care?
Gallstones?
Biliary duct is dilated. Probably from stone lodged in it. Must have caused a nasty case of pancreatitis.
She's 6. 6-year-olds don't get gallstones.
So she didn't have pancreatitis.
Your theory is an invisible gallstone?
His theory correctly predicted pancreatitis.
You might want to wait until he actually tells us his theory before you start kissing his theory's ass.
My theory is vanishing gallstone. She had it, it passed. Those things travel in packs. The rest of them probably hiding out in her gallbladder. Do an ultrasound. If I'm right, take out the organ so we can analyze the stones. Sorry. Didn't know you wanted your kid dead. Although, for a couple of G's, I could still make it happen.
Who the hell are you?
I am a complete stranger who apparently cares more about whether your kid dies than you do.
You're Dr. House.
You've seen my stage show.
She's not dying. She has pancreatitis. Once you've treated that, I'm taking her home.
And do what? Burn sage? I want you to do the surgery.
My father had gallstones. They were totally harmless. Alice had one bad one, but it passed. For all we know, this is over.
And for all we know, she could get sick again tomorrow.
Then I'll take her to her pediatrician. She's 6, Rob. She shouldn't have unnecessary surgery.
Or a moron for a mom. But what can you do?
You're the doctor. I'm the mother. I outrank you. Live with it.
How could she be allergic to everything?
She can't be. Has to be an infection.
You see a positive allergy test and decide it's infection.
Bacteria got into the scratches in her back.
Infections radiate. The shape of this isn't...
Eat this.
I don't feel like eating.
Make you better.
A sandwich.
Magic sandwich.
There's no such
Just
thing.
take a damn bite, okay, kid? Amazing how she didn't go into anaphylactic shock.
It's diagnostically ridiculous.
Right. She's allergic to everything except peanuts.
She is allergic. Antibiotics could cause a massive systemic reaction.
If she's allergic. She's not.
Chase, you're right. The shape indicates allergy, the tests indicate allergy. Just because she's not allergic to peanuts doesn't mean she's not allergic to lidocaine or...
Chase, hang the bag. You can grow a backbone tomorrow.
No, I'm not giving my daughter drugs that could shut her system down.
You know what else shuts down systems? Death.
Sorry. I can't let you do this.
If she were allergic to this antibiotic, we would have seen it by now. I think we are out of the woods as far as that goes.
Guess they occasionally get one right.
You're gonna be glib about this? You almost killed her.
I made a choice. The same choice you made yesterday, only when I make it, I'm an imbecile.
Every decision you have made has been wrong. When this is over, I'm suing for sole custody.
Because I trusted doctors when you didn't?
Because it's not just about the past 2 days.
Like you have the hotline on what's best for Alice. She loves me.
It's she never does her homework when she's with you. She never brushes her hair.
Her heart's racing, pressure's rising. The two of you, get out.
I'm her mother. You can't just...
You fight. She has an anxiety attack. The two of you are making her worse.
Get out and don't come back. Is Alice having some procedure done?
She's fine, she's resting.
Where?
In a room where you're not supposed to...
I was just at the window. There's no one in there. Her backpack wasn't there either. You don't think her father could have...
Call security. Get a gurney.
She's stiff. She can't move.
I don't know what happened. I mean, she seemed fine.
Let's help her, please.
How the hell are there no ice packs in the OR?
Flat's out. Ice packs aren't gonna hold it for long. Where are the blankets?
In the ER. They're dealing with a 4-car collision.
We need to cool this kid down before her brain melts. What are you doing?
She got a major dose of heparin to thin her blood for the procedure. Could have induced thrombocytopenia.
That's unlikely. The charcoal would have absorbed a lot of the heparin. She's been anemic. Could be a primary blood disorder.
Or we never cured the infection.
Are you saying she never had rise? We just put that little girl through excruciating pain.
The pain wasn't House's fault. Even if the clot was a reaction to what we gave her, we still had
I don't need you to cover my ass. What I need is my Vicodin. 2 pills every 6 hours, like I'm on an allowance. She's giving the cop leverage over medical decisions. What the hell? Why don't we get a plumber in here? Ask his opinion. Hey, cut it. You know any rodeo clowns who can weigh in? Where the hell is she?
Look at her arm.
I told you it was an infection.
We fixed the infection.
Well, apparently not. I asked you for broad spectrum. You put her on the bare minimum. It's a good thing you failed to become a mom because you suck at it. The infection's morphed. It's moved into her muscle sheath.
Necrotizing fasciitis?
That's impervious to drugs.
The only treatment is to cut away the infected area. So we amputate.
Arm and leg? We can't cut a 6-year-old kid in half without a confirmed diagnosis.
Moves too quickly, and we waited too long. We don't have time for culture.
We can at least observe her for a few hours, confirm the rash is spreading.
If it spreads, she dies.
You're talking about crippling her.
We're not even certain this was an infection.
Right! She's sick. She's cute. She can't have flesh-eating bacteria. It's just wrong. Let's cure her with sunshine and puppies. Cute kids die of terrible illnesses. Innocent doctors go to jail. It's because cowards like you won't stand up and do what's required. You could sit around and moan about who's the bigger weakling. I'm gonna go do my job.
Hey, get that thing away from me. I don't want to get burned.
There's a pointers don't burn, you genius.
Skin, no. Retina, yes.
You don't trust my aim? Maybe you should cover any sensitive... He was wrong about the puppies. House! Gotta stop the surgery. She doesn't have necrotizing fasciitis.
Oh, good.
She's got erythropoietic protoporphyria. She's allergic to light. It's genetic. Either parent could have carried it.
I know what it is. Infection fits better.
She gets worse every time she goes under surgical lights. Dad takes her outside.
Liver shot, too. She swallow a flashlight?
Stop the surgery.
Get the hell out of my way.
No, I'm... Light damages the blood cells. The damaged blood cells contain protoporphyrin. The protoporphyrin builds up in the liver. That's why the liver's shutting down.
She'd be allergic to light. She's never had this problem before. The negative reaction starts at birth. It reaches critical mass around this age. Her blood cells create chemicals in reaction to light. When they reach the liver, it tries to filter out the bad cells. The chemicals damage the liver, and one byproduct is gallstones.
So she'll just keep getting worse?
EP can be managed. We'll give her beta-carotene. She's gonna need special light bulbs and filters on the windows. She's probably gonna need to be homeschooled. Her life will be complicated, but she will live.
Male, 34. Just got out of the Marines after 2 years in Iraq. Admitted complaining of chronic fatigue, joint pains, intermittent rashes, and sore throats. Thinks he has Gulf War syndrome.
Why is he here instead of the VA?
He has a rich uncle Cuddy is trying to avoid filleting, who doesn't buy the VA's diagnosis of nothing's wrongatosis.
The VA's right. There's no such thing as Gulf War syndrome, especially in veterans who've never served in the Gulf War.
Different war, same place. Whatever was there in 1990 is still there.
What's there can send you home in a pine box, but it can't get you sick 3 months after you've gotten home.
What, so thousands of soldiers are lying about the symptoms?
You send 700,000 people on vacation to Hawaii. Some are gonna come back sick. Doesn't mean it was caused by snorkeling.
He's right. Studies all show the same pattern of symptoms in veterans who were sent to the Gulf and those who weren't.
That's it? You believe her, but not me?
Stick to your guns, Chase. Just because there isn't a single unifying symptom doesn't mean there isn't something going on. It could just affect everyone differently.
You think this guy has Gulf War syndrome?
Of course not. He's depressed and he's looking for a disability check. Most likely because he's just realized that knowing how to barter for sex in 6 languages and open a beer bottle with your eye socket are not the most marketable skills.
Why'd you take this case?
Because a good scientist continually questions his own theories and assumptions.
Cuddy's making him.
And now I'm making you. Do a full physical and recheck his blood for HIV, Hep C, malaria, schistosomiasis, and T strain A Bumani, just to make sure the VA's dotted their I's. And find out every hospital and clinic he's ever visited, every city he's ever lived in, and whether he's ever been on TV.
TV?
Problem could be neurological. Everyone knows TV rots your brain.
Well, it's usually the worst on my palms and the bottoms of my feet. I get these black dots all over them.
I don't see anything.
It comes and goes.
You sure it's not just scrapes and bruises?
I know the difference between a rash and a bruise.
Sometimes it's harder than you realize to distinguish between the two. You obviously exercise.
My problems aren't caused by my workouts.
But you do work out. And by the look of you, pretty strenuously. That's not usually the case with patients whose principal complaint is chronic fatigue and joint pain.
I was in the Marines for 12 years. I'm used to doing PT every day. Just because I can push through the pain doesn't mean it's not there.
We're not saying we don't believe you.
The hell you aren't.
We just need to be specific about what exactly the problems are.
I sleep 10 hours a night, but I feel tired all the time. I constantly get coughs, rashes, sore throats. My knees and hips feel like someone poured sand in my joints. I get these weird tingling sensations in my legs. Sometimes they're cold. Other times, it feels like my blood is boiling. Specific enough? Look, I don't care what you guys call it. Gulf War syndrome, Iraq fever, or just crappy sickness X. I just want someone to figure out what it is so they can cure it.
Except for the supposed pain in his joints, none of the other symptoms he's complaining about are currently evident.
Besides low potassium, probably caused by him overhydrating after working out. His blood work's all normal.
Low potassium could also probably be caused by the experimental vaccines and anti-chemical warfare pills he was given before he deployed to Iraq. Not to mention the fact that whole country is littered with hundreds of tons of radioactive shrapnel from depleted uranium munitions.
You go to medical school in France, there's no trace of uranium in his urine. He was given the vaccines and meds 2 years ago without any allergic or adverse reaction.
Has he ever done any modeling?
We forgot to ask. We should send his urine to the University of Leicester. There's a professor there who's developed a more advanced screening technique for uranium.
The levels are too low for us to detect. They're way too low to cause any damage. Where are you going?
This way. Did you find out about any television or other media exposure?
Do you really care, or are you just trying to waste hospital resources to get back at Cuddy for making you take the case?
Of course I care. What a horrible thing to say. Do a LexisNexis search to get a copy of his credit report.
Before or after we tell him to eat a banana and discharge him with a psych referral?
I say before. And I say in between, give him a polysomnogram. Sleep apnea could cause chronic fatigue and paranoia. Find out where he went to summer camp.
You okay?
Yeah, just a little too much coffee this morning.
Were we walking you to the bathroom?
I wish. Wilson was just in there. These guys know what I'm talking about.
That's his 3rd REM cycle, and his breathing is completely normal. There's obviously nothing wrong with his sleep pattern.
It's not the uranium. It's got to be some other sort of toxin.
Or nothing at all. You really think there's something wrong, or you just want Foreman to be wrong?
Both.
Well, it's not his sleep pattern. If you really think it's a toxin, you can do a liver biopsy in the morning.
We can't leave. If we don't monitor the whole test, House won't accept the results. They'll just make us do it over.
It doesn't take 2 doctors to monitor what's clearly going to be a normal polysomnogram.
Oh, so you want me to stay?
You're the one who thought there was something wrong.
I never said it was a sleep disorder.
You want to flip for it?
Just go.
Oh, come on. Don't be a baby. Fine. I'll stay. You know what we could do?
Here?
Why not? We're surrounded by empty rooms with beds in them.
Yeah, and video cameras too.
So we turn them off.
Yeah, that's all I need is House or Foreman walking in on us.
We have the keys.
No. What if he wakes up?
All right. Suit yourself.
Hello? Is anybody out there? I think there's a problem in here.
What's wrong?
What do you mean, what's wrong? You don't smell that?
Nothing smells, John.
Are you kidding me? It's disgusting.
How long have you thought... Wait. Open your mouth. The smell's not in the room. It's in your mouth.
What's going on?
Good question.
Antibiotics should at least relieve the infection, which will reduce the odor and taste in your mouth.
Not soon enough.
All right. You're gonna feel a little burn.
You never even dipped? Chewing tobacco. Practically everyone in my unit did. But me, I was so paranoid about cancer.
Well, if it's parotid cancer, it's very treatable if diagnosed early.
My mom had cancer, which is why I know that diagnosing cancer early means before there's any serious symptoms. Certainly tastes like a pretty serious symptom, you know?
We'll know more after the test.
He was just trying to mess with Cuddy for wasting his time. This would have stopped as soon as the patient started exhibiting actual symptoms.
So the question is, why is he wasting our time?
Or is he wasting our time?
You think he's got a medical reason for asking for the guy's credit report?
I don't. Where were you two when the guy woke up?
We just stepped out for a second.
To do what?
To get a coffee. We'd been up most of the night.
Just pushing to make sure we have a complete history. Obviously, we're missing something or we'd have the answer.
You didn't have any coffee when you came back.
All right, already. We confess. You caught us. We snuck into one of the sleep lab rooms to have sex. We shouldn't have done it while we were supposed to be working, and we're sorry. Now, can we move on?
House to do Wilson before you do Chase.
No. You would do House and Wilson before I do Chase. Now, can we get back to work?
She did me once.
She was stoned.
Okay, this time you're gonna feel a little pressure. We're injecting the contrast material.
Hey, could you turn up the music?
Sure. Looks pretty good so far.
Still can't hear it that well.
Can you hear it now? John? John! John, can you hear me? Still no relief?
I got relief. Just got no pee.
If the pills didn't work, you may need a catheter.
You can come here to talk to me about my pee. What's going on?
He's got cancer, all right. But it's not in his salivary glands. It's in his brain. And it's bad. At least 6 tumors, maybe more. He lost his hearing. His sight's probably next.
Death is probably next.
Hang on. Hey, who's in charge of the backdrop? Naomi.
Yeah.
What's wrong with it?
Well, the words are completely jumbled. What? You can read that?
Of course. You okay?
No. Oh, God. I could be having a... what's the mnemonic? F is for face. Is my smile crooked?
What are you doing?
A is for arms. Arms.
You should really sit down. Can someone get us some water?
S is speech. I'm slurring. I'm slurring? Huh? F-A-S-T. T is time. Hurry, somebody, call 911. Tell them the vanished truck.
Welcome to the world of maternal mirror syndrome. Mom's body is like an intricate German metro system. All the trains run on time. When she gets pregnant, it's like a new station opening in Dusseldorf. Bunch of rookies running things. Bound to be mistakes. Kids playing the tracks get electrocuted. Before you know it, trains are backed up all the way to Berlin, and you get a bunch of angry Germans with nowhere to go. We all know that ain't good for the Jews.
Who are the Jews in this metaphor?
A few things can happen to a fetus in distress. It can become a miscarriage, stillbirth, very sick baby, or on rare occasion, a time bomb. Kills mom while it's dying. Good news is, we fix the fetus, mom gets better. It's the diagnostic equivalent of a 2-for-1 sale.
You said sedation was risky. This sounds insane.
The injection goes into the umbilical cord.
The baby won't feel a thing.
Fetus. I'm lowering expectations. It works here and on dates. The benefits outweigh the risks, and the paralytic will wear off in an hour, okay?
Must be easier to hear you might die than your baby might die. But if there's anyone I would trust to save my baby, it would be Dr. House. There's a blockage in the urinary tract. Simple terms, your baby can't pee. His bladder is swollen and it's crushing his lungs.
Well, can you fix it?
We can insert a small tube in the baby's bladder that makes the urine come out straight through his belly for the duration of the pregnancy. The bladder decompresses and the lungs will be able to develop normally. When the baby gets better, you should get better. First, we just have to do a test to determine whether the baby's kidneys are functioning properly.
And what if they're not?
If they're already too damaged, then there's really nothing we can do.
My stomach is killing me.
It's not a stomach.
Can you open your eyes, Emma? I just need to take a look.
The swollen bladder was not the only problem. You can't leave it inside you. We have to terminate.
Well, can't you deliver him? Put him on a respiratory machine till you figure out what's wrong.
We can. It won't matter. The fetus is still at least 2 weeks away from being viable.
Oh, well, I'll suffer through this for 2 more weeks then.
You're on dialysis for your kidneys. Your kidneys can wait. They don't make dialysis for your liver. You're not gonna make it 2 more days.
I'm not gonna let you kill my baby.
It's killing you.
I'm not having an abortion.
It's not a baby, it's a tumor. I understand dying for a cause, sacrificing your life so your child might live, but that's not the choice here. Either it dies or you both die.
Or you fix him and we both live.
I can't fix it. I'm scheduling a D&C.
I won't consent. So I guess you have 2 days to figure it out.
What if our original assumption is wrong?
It isn't.
If we assume she doesn't have Mirror syndrome, then terminating her pregnancy isn't going to help her liver at all.
We eliminated all other possibilities.
The fetus is hydropic and in distress. Emma's kidneys and liver are failing. The diagnosis is solid.
Wow. The ass kisser won't agree with you. You must be even wronger than I thought.
Fine. Let's assume she had Mirror syndrome, but we fixed it when we fixed the baby's bladder. That means that her failing liver would be completely unrelated. If it is, we can fix it, and we don't have to terminate.
So her theory is that our patient's liver problems were just a giant coincidence.
It's not a surprising coincidence. Pregnant women can develop liver problems. If this is the case, we can actually do something here. Don't you guys think that's worth exploring?
Acute fatty liver of pregnancy would have the same symptoms.
Thank you.
Brown noser.
Viral hepatitis, HELP syndrome.
Oh, look. Sticking up for your girlfriend. Who says chivalry's dead?
We were able to control the preterm labor with tocolytics. The contractions have subsided for now.
And the liver biopsy was negative. This is definitely Mirror syndrome. Her baby's doing this to her.
We're out of options.
Did the biopsy cause the preterm labor, or did it happen on its own?
It doesn't make a difference.
Preterm labor can be a new symptom. New information gives us new theories. Isn't that how it works?
Not in this case. Her body's trying to do what you refuse to. Get the baby out and save itself.
Patient's transminases are 10 times normal. Her liver's on the verge of shutting down completely.
A torch test could...
We don't have time for more tests. We have to terminate or she'll die.
What do you think House would do?
House wants to terminate.
I mean, if he didn't, if he shared my position, what do you think he would do?
He wouldn't share your pain. He'd be objective.
Right. He would prioritize his problems.
He'd terminate.
He wouldn't be afraid of screwing with her lungs if there was a bigger issue.
There is no bigger issue. She needs her lungs.
Not right now. She's already on a respirator. The machine is breathing for her. I can do whatever I want to her lungs. If you're playing catch in the living room and you break your mother's vase, you may as well keep playing catch. The vase is already broken.
Yeah, except that room can't breathe without that vase.
Putting her back on corticosteroids.
His lungs are still 2 weeks away from being viable.
But big enough for a diagnosis.
These tissue buds are new. Could indicate bronchopulmonary sequestration or diaphragmatic eventration.
I was thinking bronchogenetic cysts or bronchial atresia.
Lung lesions. We're gonna do open fetal surgery. Open the uterus, cut out the fetus so we can look around. I know you can't talk, so I need you to look petrified if you consent.
The umbilical cord won't be cut. During surgery, your body will basically serve as the baby's heart-lung machine. We find what's wrong and we fix it, if we can.
Don't lower expectations if you want them to do something.
She should know what she's facing. This is incredibly dangerous. It risks both your lives. The only reason why we're suggesting it is because there's nothing else we can do.
So my kidneys, liver, and lungs are all fine, just like that?
Just like that.
That's amazing.
What's amazing is how blonde your baby's hair is.
My baby?
You know, the thing in your belly that tried to kill you.
You've never called him a baby before.
Any pain?
Nothing I can't deal with.
You can only get out of bed to pee, poo, or shower, and absolutely no sex. So stop flirting with me.
Sorry. So this really worked. He'll be normal.
You call being born twice normal.
Thank you.
Don't thank me. I would have killed the kid. Second ex-Mrs. Wilson won money.
I'm no longer paying alimony. She wanted her independence, so she got her realtor's license.
Market's doing badly. She wants money.
Market's doing badly. She's moving into a condo.
She wants
me to take Hector.
Pool boy.
Dog.
No longer interested.
We got him on our honeymoon. So I'm like the other parent, but I can't take him. My hotel doesn't allow dogs. Besides, I'm always here.
I asked Cuddy to a play Thursday.
Oh, okay.
She said she was busy.
And you didn't believe her, so you bribed a janitor, broke into her computer, checked her appointments.
I asked her as a test.
What would you have learned if she'd said yes?
A lot about bondage. She's busy for me, but not for you. She's not interested in the play, qua play. She's interested in you.
No, I'm not getting sucked into the vortex of your insanity again. Don't pass me notes in class. Don't tell me to ask her to the prom.
Cannot see her socially. You're leading her on.
I'll consider that after I take her to the Hockney exhibit. On Thursday. See, she is busy. It's not a date. She enjoyed the play. I enjoyed her enjoying the play. The woman works hard. It's nice to see her relax.
So all this enjoying is an act of charity.
I'm keeping the receipts for tax purposes.
You like Hockney?
You heard about that?
Pop stuff or the Venezuelan pictures?
That's a trick question.
Yes, but you have no idea how it's a trick.
I like art. I'm open to new things. What's the problem?
You're going to a gallery to see Venezuelan pictures that don't exist, but you won't go to a play with me. Why?
House, why is my social life suddenly red hot? 1 minute I'm mushing along with the Huskies as usual, and suddenly it's global warming. You think you saw somebody else pick up a toy from the sandbox, and suddenly you want it.
Is that why you said no?
Maybe I just want a friend, and I thought Wilson was a safe choice.
I'm not safe. Cool. James Wilson is never the safe choice.
Going to a gallery, we're not getting married.
Sure, you say that now. He always marries them in the end.
Biopsy shows there are white blood cells in the walls of the blood vessels.
They're not supposed to get past the bouncers.
It's gotta be autoimmune. Something lymphocytic. White blood cells are attacking your own body.
Only question is, what kind of autoimmune?
Doesn't matter what kind.
It always matters what kind.
Treatment's always steroids.
Treatment is always boring. Diagnosis.
Okay, it's affecting the larger blood vessels. It's gotta be giant cell arteritis. I'll start on steroids. It's affecting the smaller blood vessels. Gotta be lupus vasculitis. I'll start on steroids. It's affecting...
Yeah, got it.
Start her on steroids.
Good idea.
Told you, that was boring. I gotta go out.
Why?
Wilson's got a date.
It's got 15-foot ceilings. It's an open floor plan. You know, I can't believe you called me.
Hey, I need a condo. Didn't you and Wilson have your first date around here?
Wow, you remember where our first date was. I didn't think you were paying attention.
Really? He's my best friend.
Our first date was in Boston.
Oh. Not quite as close to here as I remembered.
But we're not here to talk about him.
Absolutely not.
Wait till you see the kitchen. All granite countertops.
Since I wasn't paying attention back then, what was it like dating him?
So this is Hockney?
No, I don't know what happened.
I'm sure you don't. I never knew your tastes were so eclectic.
Oh, the Hockney exhibit finished on April 20th. I thought it was May 20th. Okay, my bad. This is not somewhere I'd bring someone on a date. Not that this is a date, obviously. I was just thinking, he's doing landscapes on multiple canvases now, and they're kind of peaceful, and you're always so busy.
Wow. I don't think I've ever seen you embarrassed before.
Oh, it was never a date. I was coming off a bad relationship, and he said we could go out as friends. You know, just go see plays, go to a museum. I didn't think you liked Trenton.
Love it. So he'd say it's not a date, but then he'd jump you.
Oh, no, he meant it. James Wilson, carefully calibrating his level of protectiveness for your individual needs.
Did you just compare Wilson to a tampon?
No. It was very endearing. He really just wanted to be a friend. So I jumped him. The bedroom's through here.
That's such a bad idea. There's no way that won't cause damage to the large intestine.
Are you keeping us here to torture me? Is that a bicycle pump?
That's what I'm saying.
It's like walking into a sticky trap. And once you're the focus of all that attention, it's addictive. This unit's kitchen's got a chef's oven.
I cook a lot. Go on.
It's the emotional stuff that really sucks you in. He's just so knight in shining armor, you know? Always there to support you until one day he's not, but by then you're hooked. Hey, do you think that you could talk to him about taking the dog? He's the only one that Hector really gets along with.
Hey, we're here to talk real estate, not Wilson. So you're saying if you'd actually had sex before you connected emotionally, you'd have gotten over him?
Oh, yeah, it seems weird, right? Because sex with James is fantastic. Nobody works harder to give a woman what she wants. It's got 6 burners. The chef's oven.
Right.
Addie, you're bleeding. I never even hit her.
She seems fine.
She is fine.
She coughed up blood.
Past tense.
She has diarrhea.
From the antibiotics for the infection.
Lung biopsy says she doesn't have an infection.
Well, and you screwed up the biopsy.
Well, you're wrong about infection.
If I'm wrong, then so's her body, because it obviously thinks she's got an infection or it wouldn't have gotten better from the antibiotics. What is pandiculation symptomatic of?
Yawning's a symptom of fatigue or cholinergic excitation.
Does this have anything to do with Addie?
Let's say yes.
Cerebral tumor, epilepsy, could also be a medication reaction to antidepressants or some meds for end-stage liver failure.
Let's say no.
She can't breathe. Get off the bed.
Need a crash cart.
What's happening?
Let's get her down now.
Pressure's collapsing in her lungs. She's not getting any air.
Oh my God.
I was fine. Liver enzymes were normal.
There's something called blood in the pleural effusion. Oh, no, it's not blood, it's blood. Which is great. Not for her, but for me, because it means I think it's an infection.
Labs indicated minute traces of blood.
Can't ignore the blood because it's a minority. Can you, Foreman?
If we count the traces of blood as significant, the differential isn't just infection. It could be lung cancer, breast cancer, lymphoma.
Great. Go tell her she's got one of those. Or you could tell her that we haven't given her enough antibiotics for her infection. Double the dose. Check her lungs.
We checked her lungs. They're clean.
On the outside, she needs an arteriogram.
Arteriogram was normal.
Which means her lungs are fine.
What if the clear arteriogram is significant?
It is significant. It means there's no infection.
I think there's an infection.
Infections don't come and go. People don't get better than worse on the same treatment.
Unless her body can't finish out the fight. Maybe it goes a couple of rounds, then gives up.
Why would I give up?
Maybe its name is Foreman. Come on. Where's that smile? That laugh that makes the whole world sunny without contributing to global warming. Maybe she's missing a protein.
Blood panel and enzymes show our proteins are normal.
You can't have tested for every protein. I could think of at least one you can't test for at all.
Complement factor H deficiency. If she has that, she's dead. No way to fend off bacteria. She'll get one infection after another until her body shuts down.
Maybe we can get ahead of the game, manage each symptom as it comes up. Give her 5 miserable years instead of 6 miserable months.
There's no diagnostic test for complement factor H deficiency.
So we isolate the cells that are yummiest for it. Stick a needle in her eye.
Macular biopsy was negative, which means you're wrong. There's no complement factor H deficiency.
Most likely cause of altering blood flow in the brain is a clot or a tumor.
We can rule out a clotting issue because she has a bleeding issue.
Which means we should be looking for a tumor.
I think there's an infection. Just because the cells in her eye aren't dead yet doesn't mean they're working.
So why did we do the test?
Because if it had been positive, it would have proved I was right.
But negative doesn't prove you wrong.
That's the beauty of the test.
She needs an MRI of her brain.
Absolutely. As long as you're scanning, do you mind having a boo for an abscess or something caused by an infection?
What's wrong, Addie?
My head hurts.
Brain's clean. No tumor and no abscess. All wrong.
My head. Ah! 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 My head.
It's much more likely she has an invisible protein that allowed bacteria to arbitrarily invade her lungs, then arbitrarily invade her pleura, then arbitrarily jump into her head.
If it's autoimmune, she can live. But we have to give her steroids now, before her heart ruptures.
If you're wrong and you give her steroids, she dies now. Foreman, you want to run down how it feels to go with your gut and kill a person? You can get into the whole spiraling out of control, self-doubt, resigning thing. Do it. Worst that can happen is you quit. Cameron, you want to explain to the parents why you'll be holding paddles while he's doing it? If her heart goes boom, it'll boom right away.
Chase was wrong. Eddie's kidneys shut down.
When I hear you say it, Chase, it will please me.
Doesn't mean you're right. You predicted cardiac arrest, instant cardiac arrest.
There were only two choices. Since yours was wrong, mine must have been right. Either that or we missed the leprechaun.
If you're right, there's nothing to be done. The steroid treatment we gave her means when the next infection hits, it'll hit hard. Liver failure, cardiac arrest.
But on the bright side, it confirms my diagnosis. Don't you see how incredible this call was? A protein deficiency. Can't be tested, can't be seen. I called it based on coughing blood.
You're happy about this?
She's going to die.
That's not my fault. She's gonna die anyway. And now, thanks to me, at least she'll know why.
I'm sure you'll see that gratitude in her eyes when you tell her.
How long?
2 days, maybe less. You have a condition called...
Doesn't matter.
It's a very rare protein deficiency that only manifests...
I don't want to hear it.
Okay. It's what's killing you. This is what's killing you. You're not interested in what's killing you?
Will that make any difference? Will I live any longer? Please, could you just leave?
What's the point of living without curiosity? Without craving the...
So, I'm screwing up my last few hours because I won't listen to you.
Get out of here. This is like the dark matter in the universe.
You're smiling.
No, I'm not. You can only diagnose a problem by looking at what's missing. You have got leprechauns in ya. Depression manifests in lots of different ways. Some people can't get out of bed all day. Others have serial relationships and become oncologists.
I'm dying. I'm not depressed.
Wrong and wrong. You tried to kill yourself by throwing down kitchen cleanser. Now, most normal suicidal morons would have just drank the stuff, burned the hell out of their mouth and throat. Painful, but not deadly. But being a college-educated suicidal moron, you wrapped it in gel caps or gum, which left no trace, but burned a hole in your intestine. But the body can repair almost anything, which is cool. In your case, scar tissue closed up the hole, but it also formed a bridge between a vein and an artery. Veins are supposed to help the intestine flush bacteria away, but the bridge allowed the bacteria entrance to the artery, where they got a free ride everywhere.
Can you fix me?
Surgery to fix the bridge take about 2 hours. Psychotherapy's gonna take a little longer. Why'd you do it?
I don't know. I've just never been happy. Please don't tell my parents. They'll blame themselves, and it's not their fault. Please, you can't tell them.
Technically, all you have to do is promise me that you won't do it again. And legally, I can't tell them.
I promise.